Hello. In this presentation, I'm going to focus on undertaking a systematic review or rapid review as a project for your assessment item for this subject. And those who are doing SNPG 998 will have to undertake a systematic review, but those who are doing 905 have got an option to do a rapid review of evidence. The principles are the same, and the resources for both these approaches are on the module site. We covered including the differences between the two and the key components. There are also some templates that are available, and I would encourage anyone who is considering this as an option to do a literature search and identify recently published systematic review protocols or rapid review protocols, and also recently published systematic reviews and rapid reviews. It's very important to ensure that you've got a really good understanding of what's expected, because this is a massive undertaking, and if you do not do it correctly, you are at high risk of failing this subject. You need to commit some time. You need to learn how to do database searches. The librarians are available to assist with that. You also need to ensure that you do your proper critical appraisal and write your assessment items in the required academic format, including APA referencing system. The marking guide and other resources are available on the module site, and this is just an overview, and that includes a recent systematic review that I conducted that I'll present as a protocol here for a rapid review of evidence. There are some key points for consideration. We know that clinical practice is informed or governed by guidelines, protocols, and standards. This could be local, international, or national. These standards are usually informed by the strongest, most up-to-date evidence. However, there are cases where the guidelines are not clear or are out of date. Then there's a need to identify the best available evidence. This is where systematic reviews and rapid reviews of evidence come into play. The aim is to identify the best available evidence to inform practice, to inform the development of protocols or standards, or to inform further research. If no standards or if no evidence is available, then the next step will be to undertake research. And the most effective, the most reliable evidence comes from randomized controlled trials. I'm sure you've covered the different types of studies, or you are aware and you've come across these studies throughout your studies, and I'm not going to spend much time on the different type of studies. Sufficient to say at this point that the randomized controlled trials provide the best study design. There is a well-established hierarchy of evidence for the strength of evidence. We know that systematic reviews of randomized controlled trials provide the best available evidence. If we've got the same trials undertaken in different contexts, using the same methods, comparable participants, and the same measurement tools, if we combine results from those studies, they provide us with a systematic review of randomized controlled trial, which is considered to be the best available evidence. After that, a single well-designed randomized controlled trial, so that best level of evidence, followed by other study designs that are non-randomized controlled trials. In the absence of those, sometimes we've got to use expert comment reports, clinical experience of respected authorities or bodies, and personal and opinion experience, which is considered the least reliable evidence. So in the next couple of pages, I'm going to give you an example of a protocol for a rapid review. This covers the key aspects, but it's important for you to go through the marking criteria and the resources that are available on the module site, as they provide much more detail and information that is required. I should add a comment at this stage that before you even finalize a topic, we have an example of protocols that are published on the Joanna Briggs Institute website, or Cochrane Review, or other reviews. If you do a quick Google Scholar search, you should be able to identify reviews. This is very important as it gives you an idea of the amount of work that is required when undertaking a review or a rapid review. Okay, so your first page, we have your details, your name, student number, student ID number, and the title of your protocol. This is for assessment item number 2. For number 3, you have published the protocol, so it's the actual, you have conducted a review, either rapid review or systematic review, and you are now reporting on the findings. But at this stage, it's a protocol, which is a plan, which is a proposal of what you intend to undertake. And we'll use that to also assess and mark your third assessment item. We'll go through the protocol and check to see if we have conducted it as you had planned to do. And the protocol is a very crucial component of undertaking a systematic review. Normally, you would follow your title with the objectives. The objective of the review must be stated in full and is a statement of the overall objective and the elements that should be listed as a review question. Okay, this section should be as focused as possible and make explicit what the review intends to find out. For example, the purpose of this review is to identify, analyze, and summarize the best available evidence of effective strategies for preventing and or reducing incidences of medication administration errors in acute care setting. You can see from this example that the objective or the purpose is clearly outlined. Okay, there is no ambiguity. The actual question to be addressed also needs to be included. So specifically for this review, the question is, what strategies or interventions are effective in reducing the incidence of medication administration errors in acute care settings? You might also want to include some keywords, 3 or 5 keywords that are relevant. This is also important. That should be followed by your background section. The background should describe the issue under review, including the target population, the interventions, and the outcomes that are documented in the literature. So you need to have a really good understanding of the literature for that particular topic. It should be an overview of the main issues. It should provide sufficient detail to justify the conduct of the review. Please do not just repeat a review that is already existing. Okay, because there is no need to duplicate existing review. This is the same situation or the same challenge that we faced when we're doing this project that I'm giving you as an example. Initially, we wanted to look at a systematic review of those interventions that are used to reduce incidence of medication errors, and then we found out that there were already existing reviews. So we decided to summarize evidence from those reviews. So that is something that you might need to do. The only instances where you can do another rapid review or a review on the same topic is when the existing review is old, maybe something that was conducted in the last 5 years. There is no need for you, and you'll fail this subject if you simply repeat an already existing systematic review. That is not acceptable. You have to develop something that is unique, update available evidence, or for example, as we did in this case, look at summarizing evidence from systematic reviews. I'm happy to have a discussion with people around their topics because this is an important consideration. As you can see here, I provide a background to the topic. This should be, as a minimum, at least 500 words. This is a key component of the review process. You've got to justify and give a strong reason as to why you need to undertake that review. And I've done that here, as you can see, number of paragraphs, providing existing, citing existing evidence, and providing where the gaps are. Okay, there's a lot of evidence, as I've said here. There are several existing reviews that have been identified, but they vary in quality. Okay, they also provide varying or differing results and findings, and it makes it difficult. So the idea And the aim of this particular review was to summarize those findings in a way that can inform policy and practice. Okay, the next component of the protocol is to specify the criteria for considering the studies for the review. Okay, this is the PICO format. And again, there are resources on the module site, an example from Joanna Briggs Institute, and some templates on what's expected. In this case, the type of studies were specified as systematic reviews that evaluated strategies to reduce or prevent medication errors during medication administration in acute care settings. And we also defined a medication administration error as any event or circumstance in the administration phase of a medication process that leads to or is potential to lead to patient harm. It's important to define all key terms as they relate to a topic. If you're looking at falls, you need to clearly define what a fall is. If you're looking at medication errors, you need to define what medication errors are, or infection rates, etc. Whatever the topic that you're going to focus on, you need to be clear in terms of defining key terms. Types of participants, the review, and remember when you write your protocol, it's a plan. So you write in future tense. When you write the complete review, that's when you'll be writing in past tense because you're reporting on a process that you have already done. So a proposal and a protocol is written in the future tense. It's a plan of things that you need to do. So for example, in the participants, this review will consider studies that include any person with title nurse whose scope of practice involves medication administration. I've clearly specified the participants. Types of intervention or phenomenon of interest. All strategies used by nurses to increase patient safety by reducing medication administration errors in acute setting will be considered. And I've put a limit here. You've got to qualify and quantify the intervention or phenomenon of interest. So studies involving other components of the medication process, for example, prescribing, transcription, or dispensing will be excluded. Simply because these are outside the scope of practice of a registered nurse. Types of outcome. The main outcome of interest is the incident and number of education errors and adverse drug events. Where primary outcome measures are not provided, studies reporting the use of surrogate measures that are widely used as indicators for medication safety, such as medication calculation test scores and interruptions during medication administration, will also be considered. It's important to write in the future tense because this is a plan of what you are actually going to undertake. Another key component of a systematic review or rapid review is to clearly define the search strategy. Okay, the search strategy aims to find both published and unpublished systematic reviews. Remember, this is focusing on systematic reviews, an overview of systematic reviews. The main search will be conducted in the following databases. You need to specify the databases to be searched. For rapid review, you need at least 2 databases. For a systematic review, I expect you to use at least 4 databases. And after searching those, the reference list of identified reports and articles will also be searched for additional studies. Only studies published between 2008 and 2018 will be considered for inclusion in this review. This time period was chosen so as to present the most relevant evidence as there have been considerable changes in medication administration practices. Okay, you need to give justification if there are any limitations that you're going to include. In this case, there have been significant changes in medication administration practices. You could also actually specify to say maybe the introduction of e-meds or electronic medication system have the potential to change how nurses administer medications. The next section focusing on the methods of the review in terms of the assessment of methodological quality. Okay, this is the critical appraisal. And I know and I'm sure that you have gained these skills in other subjects that you have done as part of your program of study. In this case, since I was looking at systematic review, since I'll be looking at systematic review, the most appropriate critical appraisal tool is the assessment of multiple systematic review, or the AMSTA tool. This just gives a score for each criteria, a yes or a no, and the range for the quality. You are required to attach these as an appendix. So whatever tool that you're going to use, if you're going to use the Joanna Briggs critical appraisal tools, or if you're going to use any other critical appraisal tools, you need to include them as an appendix. So this is the critical appraisal tool. It's a required attachment for your protocol. Going back to your search strategy, you're expected to provide one search strategy for one of the databases. Okay, so here you need to say an example of the search strategy that will be conducted in the Medline. It's given as Appendix 1. Medline. Is provided in Appendix A. Okay, you need to provide an example of this. It's very crucial. This has got to be detailed. It has got to be correct. You should seek advice of the librarian if you're not sure, or look at other examples of similar reviews. For example, you can say how detailed this is. I'm looking at medication errors is here, and use the combination of logic and or etc., etc. More details are available on the module site on how to undertake advanced searches in these databases. You are expected to provide one example, at least one example in your proposal or protocol as part of assessment item number 2. Okay, so the critical appraisal method, the tool that we are going to use for critical appraisal needs to be included, and you need to specify how data will be extracted. So in our case, the data to be extracted from papers include the review, will include specific details about the interventions, population, study methods, outcome of significance review, and specific objectives. A data collection tool developed for this purpose will be utilized for this step, and include the data collection tool as well as an appendix in your protocol, as you can see here. I'll provide details on the year, the author, the country, the focus of that paper, the search details, databases that were searched in that systematic review, quality score as per the AMSTA Critical Appraisal School tool, number of studies included, interventions or comparisons, and main outcome measures. Lastly, you need to describe how data is going to be synthesized and results reported. So the findings from this rapid review will be presented in a rapid form, including tables and figures to aid in data interpretation where appropriate. References should commence on a new page, and they should follow the formatting of the APA guidelines as per the resources on the module site. So all the references that you use formatted, listed in alphabetical order, and you also need to include all required appendices. In this case, you need at least 3. The first one being an example of a search strategy in the database, in one of the main databases that you're including. The second one being the tool that you're going to use for critical appraisal, and these tools have got to be consistent with the aims of your review. In this case, my review was focusing on systematic reviews, so I've got to use a critical appraisal tool that is relevant for systematic reviews. If you're targeting randomized controlled trials, you need to use the appropriate tool to critical appraise randomized controlled trial. You need to provide, as an appendix, the data extraction form that you're going to use. So this was, in a nutshell, an example of a protocol for a rapid review. It's similar to this, to one for systematic reviews, and I've highlighted and explained the differences. There are more resources available on the subject model site that you should also have a look at.